Welcome to a recent interview that I shared with a local alternative care practitioner, Todd LeCesne, who I really think of as an absolute futurist. That is someone that's taking full advantage of the synergistic potential of conventional healthcare and cannabis therapy. I hope you enjoy.
The other thing that's important to discuss in this part of the conversation is a thing called the entourage effect, and that entourage effect is essentially a whole plant spectrum effect. So we think of this plant as more effective with all of its constituents working together collectively, an entourage, if you will. This is a 1 + 1 = 3 effect. In medicine, we call this a synergistic effect. The sum of the parts is together better than individually each part alone. And so in some cases, after a patient may have started and initiated therapy with a cannabidiol containing preparation, maybe a hemp preparation that doesn't have full plant spectrum, it doesn't have trace amounts of THC, or maybe it's a distillate and it's just cannabidiol by itself, sometimes need to add that additional molecule or add those terpenes in and those flavonoids in, and we refer to that as whole plant spectrum. And so for my patients over here, we have a relationship with that Southwest Organic Products licensed producer, and I can refer patients. I'll do it directly because that would be a violation of the law to say, hey, you must go and purchase. But I give patients a list of locations where they can go and they can find these products and shop where they want to. But we happen to know the people over at Southwest Organic Producers. These folks have a strain that in my experience, has shown good effects for that particular condition, etc.
That particular dispensary is pretty close to my house, and I have to admit I have frequented it.
Oh, nice, yeah. There's good people over there.
Yeah, from my perspective, anybody that's dealing with chronic pain that has yet to find adequate alleviation has very little to lose by just experimenting with cannabis. And that, for me, it's anybody with pain, even, maybe sensitive populations and so forth. But from a provider's perspective, obviously, you don't want to do any harm that they would otherwise be not exposed to if, you didn't intervene and so forth. So are there any particular types of patients or characteristics of patients that you think are inherently, or that you've learned to experience, are perhaps not ideal cannabis patients?
That's a great question. So a couple of things on that. Number one, patients that have respiratory illness and respiratory problems shouldn't be doing any kind of inhaled medication. Any type of combusted or heated material is definitely one of those things that we would consider to be a contraindication, a relative contraindication, because we don't have data that says, hey, if you do this, you're going to get that. In the news right now, there's been a lot of talk about the vape-related illness. We've got a name for it now. It's called EVALI, so e-cigarette induced lung injury, and we look at those things as now secondary to the inclusion of vitamin E acetate as the carrier molecule for that medication within those vape devices. So at least that part has been teased out a little bit, and we know now what to avoid. There's also some recommendations. The CDC put out warnings and so forth on the use of e-cigarettes and vape devices, especially devices that are not purchased from a reputable seller. We don't recommend that you buy those things off the street. We certainly don't recommend that you buy them at gas stations, on the internet, because there's more likelihood that persons are going to try to go along with their, make more money by cutting corners with the science and adding some things that, frankly, when you inhale them and you heat them, have toxic and in some cases have been, terrible lethal effects, on that side of the desk over there. Another thing that I would think about is patients that are using a lot of different medications that happen to be medications that are dependent on an enzyme pathway for metabolism. So that enzyme pathway called the cytochrome P450 enzyme metabolic pathway. And cannabis can be an inducer or an inhibitor of cytochrome P450 enzyme pathway. And so when you inhibit a pathway, you stop its ability to metabolize the drug. When you stop its ability to metabolize the drug, the bioconcentration of that drug goes up. When you induce the metabolic activity of the enzyme pathway, then you need more drug to exert the effect. So there's certain medications that are heavily dependent on the cytochrome P450 enzyme pathway that you should be aware of what you're doing on the cannabis side before you initiate a therapy. Third class of that I would be thinking about are patients with renal failure. Do you need to adjust the dose of cannabis-based therapy for a patient who's got renal failure? Renal failure has stages of from just a small amount of microalbuminuria all the way up to stage 5 renal failure and patients that need dialysis. And the current literature states that we start at significantly lower doses for patients depending on their degree of effectiveness of their renal failure condition. I'm sure there's others. I know that we think about cardiac patients, patients on antiarrhythmic medications. There happens to be a doc in town, a cardiologist at Press that I can call up on a regular basis who's pro-cannabis, who's knowledge in cannabis, and I'll just say, hey, Dr. Friedman, how are we going to approach this and correspond with them?
Thank you for watching this part of our interview. We truly hope that it helps as many people as possible, including some of you practitioners out there that are still open-minded and want to be able to utilize as many tools and resources as possible to continue to enhance the well-being of your patients. If you appreciate the content that we're bringing you nearly every single day, please consider hitting the like and subscribe buttons or sharing these videos with your friends and family. Consider becoming a Patreon to this channel or even a donor to the University of New Mexico Medical Cannabis Research Fund, where we are working very hard conducting cutting-edge research every single day using all kinds of different types of research designs, working with humans, animals, large data sets. We do it all, and we're working really hard essentially to improve the well-being of our community. Through these efforts, collectively, together, we're starting to feel it. We're changing the world.